Hi, everybody. I'm Dr. Ardis. This is the Dr. Ardis Show. I hope you've had an incredible day, an incredible week, and whatever you're doing right now while you're watching or listening to this, I hope it is an incredible learning opportunity for you. I hope you're excited. What I'm going to be discussing is an ingredient, a natural substance found in most food on earth we eat. It is actually called N-acetylcysteine, abbreviated NAC for short. And the reason for making sure you're aware of all the miraculous life-saving health benefits of this nutrient that is also found in supplement form, N-acetylcysteine, I want to bring this to your attention because just 4 years ago from this recording, in May of 2020, right at the beginning of the COVID-19 pandemic, the FDA of the United States decided it was a good idea to ban this product from all supplement makers being able to sell it all throughout America. This actual supplement has been sold for 75 years, and all of a sudden, the FDA wanted to ban access to this life-saving nutrient right before the rollout of the COVID-19 vaccines. And I actually released in the year 2021 my own N-acetylcysteine supplement, and you can find it at the drardisnoc.com if you want. But you don't know at home that this nutrient has many more health benefits than just preventing blood clots. And we're going to dive into what a whole bunch of those are here during this review and this podcast. I have titled The Life-Saving Benefits of N-acetylcysteine. So I hope you enjoy the presentation. If you have a loved one who's dealing with any mental health issue, this is for you. Have you ever known people who pick the hair in their beards, their scalp, their eyebrows, their eyelashes? Did you know that OCD tendencies, which those are considered to be also side effects of, did you know N-acetylcysteine is a proven cure for that too? Well, that's not all. If you know anybody that's bipolar, you're going to want to see what in the world they know about this supplement and its benefits to reverse bipolar symptoms, improve blood flow, lower blood sugar, I'm not joking, and all the mental health benefits you will see, including Alzheimer's and Parkinson's, I'm about to show you. So my goal here is to make sure you have enough information to be able to make an informed decision about how it is you could take steps today to improve your health or someone you know's health. And there's no simpler way than learning today about N-acetylcysteine. Okay, so what I'm going to do is actually put up a PowerPoint presentation. As we go through this PowerPoint, if you see or hear something that I say that makes you go, hey, this is good information for someone I know at work or someone in my family or someone in my Facebook group, you want to take this link to this show and share it with those people, but also make them aware. You can tell them that at the drardisnoc.com's website, the entire PowerPoint I'm about to show you during this presentation is actually for free downloadable at the Patient Resources tab of the Dr. Ardis Show. I have the entire PowerPoint in a PDF format. You can just download it and share it. And it even has highlighted in it from each of these research studies what was the dose they found of N-acetylcysteine that helped with all of these conditions. Ready to go? Here we go. We're going to dive in. Remember to share this far and wide with your loved ones because many, many people around the world would benefit from knowing about this one simple nutrient found in almost every vegetable and fruit on earth. Now, here we go. Let's dive into the PowerPoint. Follow along. I hope you're excited. I am thrilled to present to you the life-saving benefits of N-acetylcysteine. All right, so here we go. We're going to dive right in. It should be the entire screen as you see it. If you scan the QR code on the screen, this gives you access to put in your email for all of our future presentations where I dive into nutritional health, known research studies and their benefits, and then what are some of the things you need to know about with common up-to-date real-life health news going around the mainstream media. We cover topics like lupus, cataracts, Parkinson's, bird flu, you name it. We're all on top of those, and we have presentations throughout. If you want to be notified for each of our weekly podcasts, we only do one a week. This is how you do it. Scan the QR code, put your email in, and you will make sure you're notified for all of our free produced documentation and content here at the Dr. Ardis Show. All right, so we're going to start with Healthline Magazine, a very reputable online journal for all things health. They have an article titled, What are the health benefits of NAC, otherwise called N-acetylcysteine? Well, they're going to give you some bullet points. They're going to number several of these health benefits with a number. This is number one in that article. In this article, as I go through it, you're going to see highlighted benefits of N-acetylcysteine, NAC, as it's abbreviated. I'm also going to show you right after some of these numbered highlights of the benefits of NAC. I am going to go out of the article and on the next slide show you prescription drugs used for the same reasons they're highlighting the health benefits of NAC. And I'm going to quickly show you what are the downsides of those prescription medications and what are the upsides of NAC instead. So remember, ask your medical doctor for any of these issues if N-acetylcysteine is right for you. All right, so number one, N-acetylcysteine is essential for making the powerful antioxidant glutathione. And for those who have followed me for a long time, you've heard me speak about glutathione many, many times. If you'll read the highlighted sentences in red, I'm just going to hit the highlights of these articles. N-acetylcysteine is necessary to make and replenish glutathione. Glutathione, by the way, everybody, is made from your liver. And glutathione, like vitamin C, is the most powerful antioxidant to prevent, you're going to read here, glutathione is one of the body's most important antioxidants. Antioxidants help support the body's natural immune system and toxin elimination processes. Well, for all of us that have lived through the last 4 years of the pandemic, whenever you're watching this, the COVID-19 pandemic, you were all exposed to multiple poisons and toxins that should be eliminated from your body. Antioxidant intake can reduce the risk of several chronic conditions, including cardiovascular disease, which supposedly in America is the number 1 or number 2 killer of all people. Number 2, N-acetylcysteine helps with detoxification to prevent diminished kidney and liver damage. So N-acetylcysteine helps with detoxifying to prevent or diminish the likelihood of having kidney and liver damage. This is important because every single prescription drug on earth causes liver and kidney damage. So you might want to be taking NAC to help. Here you'll see doctors regularly give intravenous NAC. They inject it into their veins to people in a hospital with an acetaminophen overdose to prevent or reduce kidney and liver damage. Well, acetaminophen is just one drug, and it can be prescribed as a prescription, as an NSAID for pain. Just want you to know all drugs cause liver and kidney damage. This is why every commercial you've heard your whole life says this. Ask your doctor to check your liver and your kidney functions often once you start taking our drug. They know the drugs are toxic to your liver and kidneys. N-acetylcysteine, if you're on a prescription medication of any kind, you should at least at a minimum be on NAC. NAC has applications for other liver diseases thanks to its antioxidant and anti-inflammatory benefits. Well, I'm about to show you a drug that is prescribed by the medical profession in the case to prevent kidney and liver damage in their patients. Ready? So N-acetylcysteine, you're learning, does it. In fact, N-acetylcysteine is so good, it can actually help prevent kidney damage in an overdose of prescription drugs. Well, watch this. Jardiance is a drug, you'll read it here, helps protect patients by reducing the risk of kidney disease progression and cardiovascular death. All right, this is Jardiance, a prescription medication. Let's look at what we know on drugs.com about Jardiance. All right, here's the serious side effects on drugs.com of Jardiance, the prescription drug to prevent kidney disease, which N-acetylcysteine is proven to do. The more common side effects section of drugs.com for Jardiance reads, it can cause bladder pain, bloody or cloudy urine. I don't know if you know this, but urine comes from your kidneys. Bloody or cloudy urine from that drug means it's damaging cells of your kidneys and you're bleeding out of your kidneys. That's why your urine is bloody or cloudy. So this drug promoted to prevent kidney disease, they're telling you the more common side effect is to cause more damage to your kidneys and make you bleed from your urine. Change in your color amount or odor or vaginal discharge. Women, I'm not sure vaginal discharge or fungus or mucus is better than having kidney damage from acetaminophen or other drugs. Difficulty, burning pain, frequent urge to urinate, lower back or side pain, pain during sexual intercourse. I just want y'all to know of all these side effects you're reading about the prescription drugs they use to prevent kidney disease that N-acetylcysteine does by itself. This drug can make your intercourse even more painful. Well, I don't like that idea. N-acetylcysteine doesn't do any of these things, has none of these common side effects as side effects listed. The less common side effects of Jardiance, which is also used in diabetes, by the way, discharge with a strong odor from the penis. That doesn't sound good, men and women. I think I'd prefer N-acetylcysteine. Women, I bet you'd prefer it too. And then another common side effect, but less common, increased volume of pale, dilute urine, redness, itching, swelling, or pain around the penis. That doesn't sound good either. Or waking to urinate at night. That sounds like prostate problem. Well, I guess Jardiance has a prostate enlargement issue also. You get into the rare side effects of this drug: anxiety, dizziness, faintness, heartbeat faster, increased hunger, rapid breathing, seizures, slurred speech. That doesn't sound good. All right, that sounds like Bell's palsy or stroke. All right, these are rare side effects of the drug, but in any case, none of these side effects are N-acetylcysteine supplement side effects. They don't have these side effects. Now, N-acetylcysteine, let's go back to the Healthline article, may improve mental health conditions and substance use disorders. Did you know that N-acetylcysteine, the supplement I have in my website, N-acetylcysteine, did you know that it helps regulate glutamate levels? Now, I don't expect you to know what glutamate is, but that's the brain's most important neurotransmitter. So if you're trying to remember things, calculate things, focus on things, you need glutamate to do any of that. N-acetylcysteine helps regulate it. And N-acetylcysteine helps to contribute to mental health conditions. If you reduce glutamate levels, you will experiment if you have glutathione or glutamate depletion in your body. It contributes to mental health conditions such as bipolar disorder, schizophrenia, OCD, and substance use disorders. For people with bipolar disorder and depression, N-acetylcysteine may help decrease symptoms and improve quality of life. Moreover, research suggests that it might play a role in treating moderate to severe obsessive compulsive disorder. Did any of you know that? I think this is amazing. Number 4, N-acetylcysteine is known to help relieve symptoms of respiratory conditions. N-acetylcysteine as an antioxidant helps replenish glutathione levels from your liver. And that glutathione level will go to your lungs, and it reduces inflammation in your bronchial tubes and lung tissue. Some studies even suggest that taking N-acetyl supplements can help improve COPD symptoms, exacerbations, and lung decline. Well, how many people do you know that have COPD or have asthma or have chronic pneumonia? You might want to tell them about NAC because it's proven to do that in multiple research studies. People with chronic bronchitis can also benefit from N-acetylcysteine, says Healthline magazine. Bronchitis occurs when the mucous membranes in your lungs, bronchial passageways, become inflamed, swell, and shut off airways to your lungs. By thinning the mucus in your bronchial tubes you breathe through and boosting glutathione levels, NAC may help decrease the severity and frequency of wheezing, coughing, and respiratory attacks. N-acetylcysteine may improve other lung and respiratory tract conditions like cystic fibrosis, asthma, and pulmonary fibrosis. I don't know if y'all know about pulmonary fibrosis. That's where your lungs turn to cartilage. Right now, the only thing doctors tell you is that you have a lung transplant in your future. And if you don't get one, you're dying. Where you're learning right here that N-acetylcysteine found in our store at the Dr. Ardis Show is known and found in studies to help improve cystic fibrosis, asthma, and pulmonary fibrosis, as well as symptoms of nasal and sinus congestion due to allergies and infections. Well, we're about to move into winter and summer or spring now in 2024 and into 2025, and you're going to see massive seasonal allergy symptoms. Well, now you know what you can use. Now, there is a drug that's commonly used right now for the flu season and respiratory infections called Tamiflu. Did y'all know that Tamiflu has common side effects to increase phlegm-producing coughs? Tamiflu does, and also can increase your wheezing. And did you know it can create shortness of breath, faster irregular heartbeats, facial swelling, unusual weight loss, diarrhea, watery and severe, and bloating? These are just some of the other side effects known about Tamiflu. Well, N-acetylcysteine is one of the 5 ingredients in my Dox viral defense that we created and formulated during the COVID-19 pandemic. They called it a respiratory virus. I wanted to make sure people knew N-acetylcysteine is able to prevent respiratory infections. All of them, like I just showed you. Number 5 benefit by Healthline magazine is boosts brain health by regulating glutamate and replenishing glutathione. We've already seen a reference to this. Because N-acetylcysteine helps regulate glutamate levels, which are important in OCD, schizophrenia, and bipolarism and depression, because N-acetylcysteine helps regulate glutamate levels and replenish glutathione, it may benefit those with health conditions affecting the brain and memory. Alzheimer's disease slows down learning and memory capacity. Animal studies suggest that N-acetylcysteine may slow the loss of thinking ability in people with Alzheimer's disease. Did you know Parkinson's disease is characterized by the deterioration of cells that generate the neurotransmitter called dopamine? Anybody diagnosed with Parkinson's, has a loved one on Parkinson's, you know their drugs they take are titled this: L-Dopa, Cardopa. Dopa is short for dopamine. We all know the correlation between Parkinson's and this hormone. N-acetylcysteine supplements appear to improve both dopamine function and disease symptoms such as tremors in Parkinson's patients. Now, there are medications that are prescribed for Alzheimer's and Parkinson's, and some of those are called these. You'll see them highlighted on the screen. This is from the NIH's website. Galantamine, benzgalantamine, rivastagamine, and donepezil are cholinesterase inhibitors that are prescribed for mild to moderate Alzheimer's symptoms. And these drugs may help reduce or control some cognitive or behavioral symptoms. Well, let's see what the side effects of these are. N-acetylcysteine doesn't have any of these, but it's important for you to know. Galantamine, going to drugs.com. You see there's serious side effects. I want to read these to you. If you have Alzheimer's, have a loved one with it, this is most likely what your neurologist is going to prescribe. Did you know that chest pain or discomfort is a common side effect? Did you know dizziness and fainting in your elderly and Alzheimer's patients is a side effect of the drug? Shortness of breath, shakiness in the legs, arms, hands, or feet. So tremors, slow or irregular heartbeat, and unusual tiredness. Blurred vision, confusion. Oh my goodness. Alzheimer's comes with dementia. You don't think they're already struggling with confusion? These are also published side effects, although rare, they say, that's still known to cause it. Fainting is a side effect of this drug for Alzheimer's. Fast, irregular pounding or racing heartbeat, rapid breathing, dizziness, faintness, or lightheadedness. These are all published side effects. Trouble breathing, sunken eyes, wrinkled skin. Y'all want to look older? All this anti-aging stuff you're reading about. That's only if you want the drugs. N-acetylcysteine doesn't do any of that to you Alzheimer's and Parkinson's patients. Number 6, N-acetylcysteine may help improve fertility in both men and women. This was exciting to me. Why? I have 5 kids myself. My wife has 3. We have 8 together. And there's a whole lot of people struggling in the world right now to conceive. If you have any children, grandchildren who are struggling to maintain a pregnancy, getting pregnant at all, seeking fertilization treatment, you might want to consider N-acetylcysteine after I read to you what you're about to hear. Approximately 15% of all couples trying to conceive are affected by infertility. In almost half of those cases, male infertility is the main contributing factor. Now, this is important because most infertility clinics will tell you it's women's faults. No, over half of all infertility cases, it's blamed on the men. Many male infertility issues increase with antioxidant levels are insufficient to address free radical formation in their reproductive organs, testes. In one study, 35 men with varicocele received 600 milligrams of N-acetylcysteine. Now, varicocele is like reduction of semen, reduction of sperm, and reduction in sperm swimming ability. So in this study, 35 men that had this problem with infertility received 600 milligrams of N-acetylcysteine daily for 3 months after surgery. Their combination of surgery and N-acetylcysteine supplementation improved semen integrity and partner pregnancy rate by 22% compared with the control group that saw no improvement. When it comes to treating males for infertility, you'll see on the screen the most common drugs they use. Clomiphene or Clomid is the name of this one. I want to show you what are some of the known side effects of this male infertility drug. N-acetylcysteine doesn't do this. Clomiphene, otherwise known as Clomid as a brand name. Clomiphene is a non-steroidal fertility medicine. What are its serious side effects? Look at this: bloating, stomach or pelvic pain, blurred vision, seeing flashes of light, sensitivity to eyes to light, yellow eyes or skin, that's jaundice from liver failure, decreased or double vision or other vision problems. N-acetylcysteine doesn't cause any of that issues. Did you know that it also has less common but rare side effects also? I mean, these are awful. Breast discomfort, dizziness or lightheadedness, headache, heavy menstrual periods in females, mental depression. You're already depressed if you can't have a baby or expand your family. Why add depression to the list? Nervousness, trouble sleeping. N-acetylcysteine doesn't have that effect. Now, I'm going to show you a research study that highlights just how impactful N-acetylcysteine helps with fertility issues. You're going to see it here in just a minute. Healthline magazine also states N-acetylcysteine may stabilize blood sugar by decreasing inflammation in all of our fat cells. Animal studies show that N-acetylcysteine may stabilize blood sugar by decreasing inflammation in fat cells and thereby improving insulin resistance. That's all of you type 2 diabetics. If you're on metformin, glucophage, you name it, or even insulin. Insulin resistant means your body's making insulin, but it's not breaking down blood sugar. There's a couple things here. N-acetylcysteine stabilizes blood sugar and improves insulin resistance. But don't forget bioactive copper. The enzyme required to make insulin break down blood sugar is copper dependent. That's one capsule of our bioactive copper at the Dr. Ardis Show also. Just speaking about diabetes and blood sugar. All right, now when it comes to blood sugar, one of the most common prescribed drugs is glyburide. Diabeta is the brand name, Glinase or Micronase. Sounds like mayonnaise. All right, what is glyburide? It's an oral diabetes medication that helps to control blood sugar levels. And acetylcysteine does it, and it doesn't require a prescription, and you won't see it on drugs.com. What are some of the serious side effects of this blood sugar drug? Oh, it only causes difficulty swallowing, dizziness, fast heartbeats, skin rashes, puffiness of the swelling of the eyes or around the eyes, lips, face, tongue, tightness in the chest. That sounds like a heart attack. Trouble breathing. That sounds worse. Unusual tiredness or weakness. And then vomiting of blood is a side effect of this drug. I don't like that one. Diarrhea, clay-colored stools, nausea and vomiting, unpleasant breath odor. Sounds great. They don't know how many people this affects, but these are published side effects of this drug called glyburide. Look at this. Incident isn't reported yet, but they know it is published. Look at coma. Did you know this diabetes drug can cause coma? Cause you to go into a coma. I don't like that idea. N-acetylcysteine's never caused a coma in anybody. Bleeding gums. That sounds amazing if you take that drug. Blood in the urine or stools, more kidney failure, back, leg, stomach pains, convulsions are a side effect of this drug. Depression is a side effect of the drug. Irritability, general body swelling. Who doesn't want their body to swell? I can't even think of anybody who doesn't want their body to swell. Everybody loves swelling. Sore ulcers, stupor is a side effect of this drug. Do you know what stupor is? You can't get them to wake up. You can't get them to look at you and talk to you. They're just sitting there in a stupor. Can't react to anything you're doing. Now back to N-acetylcysteine. Just showing you what it is your medical doctor will often prescribe, but NAC is already proven to do the same thing without those horrible side effects. Number 8, N-acetylcysteine may reduce heart disease risk by preventing oxidative damage. Oxidative damage from stress to heart tissue often leads to heart disease, causing strokes, heart attacks, and other severe conditions. N-acetylcysteine may reduce heart disease risk by reducing oxidative damage to tissues in your heart. Anybody out there with heart disease? Studies show that N-acetylcysteine may protect heart function and heart health in people with diabetes and those recovering from certain heart surgeries. How amazing is that? Well, let's look at a drug they use for heart disease and strokes. Alteplase, otherwise known as Activase or Cathflow Activase. This is just one drug they use, and you'll see what it's used for. Highlighted sentence at the bottom. Alteplase is a thrombolytic drug, sometimes called a clot-busting drug. Let's look at its side effects. N-acetylcysteine doesn't do this, but it breaks down blood clots. It's amazing. You're going to see a study here in a minute. It's going to blow your mind. Serious side effects of Alteplase. These are the more common side effects. Bleeding gums. Oh, that sounds awesome. Coughing up blood. Who wants to cough up blood? That sounds horrible. These are the more common side effects. Nosebleeds. Paralysis. Could you imagine being paralyzed by a medicine they're trying to give you to break down a blood clot? Oh my God, that's awful. The threat of stroke is that you're going to lose the ability to control parts of your body, being paralyzed. The drug has this as a more common side effect, people. Increased menstrual flow or vaginal bleeding. Sounds amazing. Rare side effects include unexplained shortness of breath, sudden severe weakness or numbness in the arms or legs. That doesn't sound good. Sudden loss of coordination. Slurred speech, like a stroke. Rapid shallow breathing. Fast heartbeat. Fainting. Confusion. Vision changes. You either can see or you can't see. So your vision must be getting worse. All right, so that's that drug. N-acetylcysteine doesn't do any of that, but it does help prevent blood clots, even as powerful as most blood clotting drugs. 9, benefit of N-acetylcysteine per Healthline magazine. It has the ability to boost glutathione levels and improve immune function. Research on certain diseases associated with N-acetylcysteine and glutathione deficiency suggests that supplementing with NAC might improve and potentially restore immune system function. Whew, well, you're hearing about Make America Healthy again. N-acetylcysteine can make your immune system healthy again. All right, this is some research articles that are now we're going to highlight the science, the cool things they found in scientific studies when they looked at N-acetylcysteine with other drugs or placebos in different conditions in human beings. N-acetylcysteine for the treatment of psychiatric disorders, schizophrenia. N-acetylcysteine acts at multi-points within the brain to potentiate activities that are beneficial to schizophrenia. Patients treated with N-acetylcysteine showed increased multivariate phase synchronization brain function that altered the neuron connectivity of the brain, measured using electroencephalogram, a device in medicine. N-acetylcysteine may be efficacious in reducing both negative and general symptoms of schizophrenia. How many of you have been told that? Has your neurologist told your loved one about N-acetylcysteine in these studies on schizophrenia? A meta-analysis looking at multiple studies included 3 randomized control trials with 307 participants, showed that N-acetylcysteine significantly, not a little bit, significantly improved total symptom score in schizophrenic patients. 307 people with schizophrenia. They further went on and reviewed an antioxidant treatment for schizophrenia, have also found that N-acetylcysteine to be a promising add-on treatment for schizophrenia, and the 3 or 4 studies referenced there. Then there was a large, several clinical trial found that taking 1,000 milligrams a day of N-acetylcysteine twice a day, 1,000 milligrams twice a day, to be more effective than taking a similar dose schedule of placebo in improving the total negative and general symptom scales of 140 chronically diagnosed schizophrenic patients over a 24-week period. Ask your doctor if N-acetylcysteine is right for you. And just so y'all know, if you think this is just for schizophrenia, schizophrenia is labeled as the worst of all mental health diseases on a scale. Everything below schizophrenia is bipolarism, OCD, manic depression, general affective depression disorder. All of those are less severe than schizophrenia. If N-acetylcysteine helps with schizophrenia, any of the other ones I just mentioned, for sure NAC will benefit. Those treated with N-acetylcysteine, 1,000 milligrams a day in the first week, they then increased it to 2,000 milligrams a day for 7 weeks, achieved, listen to this, statistically significant improvements in the total and negative symptoms of schizophrenia compared to those on placebo over the 8-week period. A very large clinical trial is currently being conducted across 4 Australian sites to investigate the efficacy of N-acetylcysteine as an adjunctive medication, an added medication to clozapine in the treatment of schizophrenia. Did y'all know that? That's what these researchers have discovered. No American clinic's doing that. 168 clozapine-resistant schizophrenias. This means 168 people with schizophrenia were given this drug, clozapine, and it didn't do anything for them. It failed them. They took 2,000 milligrams a day of either N-acetylcysteine or a placebo for 52 weeks, a whole year. Positive results from the trial will certainly confirm that N-acetylcysteine is an effective add-on treatment for schizophrenia. Now let's look at OCD. I have some very close friends who are OCD. I don't have any family members I know that are OCD, but I have a lot of people I know that are OCD. Did you know that N-acetylcysteine has been proposed as a novel treatment? Other related disorders such as trichotillomania, hair pulling disorder, eyebrows, eyelashes, skull, beards, mustaches, onychophagia, nail biting, Tourette syndrome, and excoriation, skin picking, also share some common neurobiology that can be potentially treated with N-acetylcysteine. Amazing. A thorough review of the literature on medical studies on N-acetylcysteine found that a review of N-acetylcysteine for the treatment of obsessive compulsive disorder and related disorders by a researcher named Oliver. And they show the reference. Treatment with 2,400 milligrams to 3,000 milligrams a day of N-acetylcysteine in the included trials was found to reduce the severity of symptoms and demonstrates good tolerability and minimal adverse effects. Isn't that awesome? N-acetylcysteine to be an effective add-on citalopram in improving resistance control to compulsions in children with OCD, obsessive compulsive disorder. N-acetylcysteine was found to be an effective add-on to citalopram in improving compulsions in children with obsessive compulsive disorder. Significant reduction in the score of resistance to obsessions was detected in the intervention group after supplementing with N-acetylcysteine 2,400 milligrams a day for just 10 weeks. There was no significant changes seen in the placebo group, only in the N-acetylcysteine group. Anybody out there who knows obsessive compulsive children who have outbursts, N-acetylcysteine 2,400 milligrams, you can get it at the Dr. Ardis Show or anywhere else on earth if you want to. Now, for mood disorders and bipolar and depression, they have found research now linking low mood to being increased oxidative stress on the human body and dysfunction of the glutamatergic systems, with N-acetylcysteine being explored as an adjunctive therapy alongside primary antidepressant treatment. Trials using N-acetylcysteine for depression symptoms, regardless of the main psychiatric condition, they found a total of 574 participants. 291 N-acetylcysteine, 283 were given a placebo. N-acetylcysteine was shown to significantly dissolve and destroy depression symptoms and improved overall human functionality. Incredible. How many of you know people on Prozac, Zoloft, and other antidepressants? Did you know that N-acetylcysteine is cheap and doesn't require a prescription of any kind and has already been proven to ameliorate? That means to get rid of all symptoms of depression. Isn't that amazing? A new trial explores the effects of adding N-acetylcysteine treatment with inflammatory and neurogenesis markers in the single polar depression people. So you have bipolar, means there's two forms of mental function. You're either high functioning for a while, then you go depression. That's bipolar. In this case, these are just people that are just overall depressed all the time. They're not seeing upswings and downswings. They're just always down. So in unipolar, that means one. We've only seen one, in one type of depression, you're just depressed. N-acetylcysteine treatment of 2,000 milligrams a day significantly improved depression symptoms over the 16 weeks trial. I'm sure you guys were not aware. I'm very, very thrilled to know that N-acetylcysteine, a very common supplement, cheap to provide to people around the world, found in foods, vegetables, fruits, and nuts, can be compiled at milligram doses in convenient capsules to help improve your mental state. Studies support the continuing research effort in the study of N-acetylcysteine for the treatment of psychiatric disorders. The available evidence certainly supports N-acetylcysteine to be a viable added treatment option in clinical settings. And this is the dose range, everybody listening. If you have a loved one who has depression symptoms of any kind, a dose range between 2,000 and 2,400 milligrams a day was suggested to be effective and well tolerated from these research studies. This is N-acetylcysteine, one of those studies, N-acetylcysteine in depression symptoms and functionality. Treatment with N-acetylcysteine improved depression symptoms as assessed by this scale they use, Montgomery-Åsberg Depression Rating Scale, and the Hamilton Depression Rating Scale when compared to placebo. Subjects receiving N-acetylcysteine had better depression symptom scores on the Clinical Global Impressions Severity of Illness Scale at follow-up than subjects who did not get N-acetylcysteine. Global functionality, how the whole person behaved and functioned, was better in the N-acetylcysteine groups than in the placebo groups. Conclusions. Administration of N-acetylcysteine ameliorates, dissolves depression symptoms, and improves functionality and shows good tolerability, meaning no side effects. The effects of N-acetylcysteine supplementation on sperm quality, chromatin integrity, and level of oxidative stress in infertile men. This is where I told you early on in this broadcast, I'm going to show you studies that will blow your mind. If you are struggling to conceive, If you are thinking about infertility clinics as a couple or a person, you've got to consider N-acetylcysteine, and I'm going to show you why. N-acetylcysteine supplementation significantly improved sperm total swimming, called motility, progressive motility, its ability to go farther, and sperm concentration, how many sperm the man made. The average percentage of non-progressive swimming of the sperm and immotile sperm, those not swimming at all, and abnormal morphology showed a significant improvement after treatment. So they saw all of those things reduce. The sperm that couldn't swim, the sperm that couldn't swim very far, and DNA damaged sperm. They saw that all reduce in the N-acetylcysteine supplemented group. And when you look at the table from the research study on the left, you see the sperm parameters. They're looking at the volume, how much there is. And you can see before N-acetylcysteine and after. You see the volume of sperm went up. The total swimming percentages of sperm that could swim went up with N-acetylcysteine. Their motility, being able to go further, it went up too. And then you'll see the non-progressive, those sperms that could not swim very far, you see the number of them went down from 19 to 16 with N-acetylcysteine. Those sperm that couldn't swim at all, called immotile sperm, that went down also using N-acetylcysteine. And then the overall sperm concentration goes up with N-acetylcysteine, which helps you get pregnant. And then abnormal DNA sperm, those that were sick, couldn't swim, something was wrong with them genetically, that went down, the number of those, when you gave them N-acetylcysteine, all males. Now, I'm not going to actually elaborate on this summary. I'm just going to show you a chart from the research study. They actually wanted to know how many sperm are in the male who cannot get pregnant with their spouse or partner. How much of their sperm have DNA damage compared to those who are able to have babies? Well, when they looked at the quality of the sperm in those who were having struggles getting a woman pregnant, they could chart how many of the sperm had DNA damage, and then after N-acetylcysteine, how many of them no longer in the same person were damaged DNA-wise. And look at this chart. Look at the bar graph. You see the DNA fragmentation percentage, how much of them had DNA damage. They were genetically mutated before N-acetylcysteine and after. You see the number of them went down. On the far right, you'll see them highlighted in red and green. They just were using radioactive substances to highlight those that were damaged and not damaged. And you see in the study, you can see that there are less DNA damaged sperm after NAC than compared to not having NAC before the trial. Then they wanted to compare what happens when we give N-acetylcysteine to these infertile men. What happens to their three major hormones responsible for fertility? They're called FSH, LH, and testosterone. They found that the average values of follicular stimulating hormone and luteinizing hormone significantly went down, which is important for a man to help get a woman pregnant. That needs to be lower. While the average value of testosterone significantly increased after treatment with N-acetylcysteine. Well, we all know testosterone's impact on sex. We know testosterone's impact on sperm production and ejaculate load and being able to have an orgasm. Testosterone drives all of it. So to see that they found N-acetylcysteine significantly increases testosterone levels should be a huge blessing to many men and women who are trying to have children. I wanted to show you what FSH stands for, follicular stimulating hormone and luteinizing hormone. And here you actually see the numbers. FSH, LH went down after N-acetylcysteine in the males, and testosterone goes up significantly. Supplementation from these researchers doing this study on sperm in males with N-acetylcysteine. Supplementing with N-acetylcysteine significantly improved sperm parameters, the count of sperm, how many there were, the motility, and their normal morphology or development from pre-treatment baseline. So when they tested the sperm of the man before, after they gave him NAC, they saw massive improvements in everything related to sperm. N-acetylcysteine originates from its ability to stimulate and sustain intracellular levels of reduced glutathione and also to detoxify stress from the body. Reported significant improvements in all semen parameters in subjects receiving selenium or N-acetylcysteine with an additive effect on the combination group. This is important. NAC and selenium are required by the liver to make glutathione. I have done many interviews and productions and shows on selenium and its impact on glutathione production. You're learning here all the benefits of glutathione that come from NAC supplementation. But in this research study, they're telling you about sperm and infertility. They found that in studies where they were investigating sperm count in all sperm parameters, when they used N-acetylcysteine, in the studies where they took NAC and selenium and combined them, it had an added effect to increase the semen count, the sperm count, the semen load, sperm count, swimming ability of all the sperm, period. I always recommend everybody takes a minimum 200 micrograms of selenium every single day. We have selenium at the Dr. Ardis Show too, but I wanted you to see, not only did they see NAC helped men become more fertile, in every study, when they added selenium supplementation with the NAC, it would just be one capsule of our selenium with NAC. They saw an added benefit, increased benefit to all fertility parameters. Stress appears, in the conclusion of the study, stress appears to play an important role in the generation of sperm DNA damage, impairment of semen parameters, and failure of sperm functions to swim, leading to male supplementation with N-acetylcysteine for at least 3 months. In those people who have low sperm functioning, benefited from reverting these damages, and it was likely due to its positive effect in acetylcysteine on the antioxidant defenses of the human body. Then we're going to get here. This is the final research study I'm going to show you. The words are important. Potent thrombolytic effect of N-acetylcysteine on artery blood clots. The very first word is very significant for a published research journal on the CDC's website and the NIH's website, which is where this comes from. Potent, that means it's really, really effective. Thrombolytic effect dissolves blood clots of N-acetylcysteine on blood clots and arteries of the human body. Now, at the top of this next article, you're going to see the word recanalization. In this research study that I just highlighted. This section's titled NAC Induces Arterial Artery Recanalization After Acute Blood Clots, called a thrombus. I wanted to put on the screen what recanalization means so that you knew what NAC was doing. It says N-acetylcysteine induces artery recanalization. If you look at the definition from Merriam-Webster's dictionary, recanalization means the process of restoring flow to or reuniting an interrupted channel of a bodily tube, such as a blood vessel or vas deferens in the testicles. Okay. N-acetylcysteine induces artery restoring blood flow after an acute blood clot or stroke. They were studying here that after investigating, they wanted to know, does NAC, can it disaggregate or dissolve platelet-rich thrombi? Thrombi being a blood clot. To this aim, we injected 400 milligrams of N-acetylcysteine. N-acetylcysteine administration led to a rapid and significant dissolving of the blood clot, reaching up to 53% of the baseline cerebral blood flow. Not only did it dissolve the blood clot in the brain, it actually increased the blood flow by 53% very rapidly. In fact, the statement above is within 20 minutes. How many people have strokes and have blood clots and are actually being told you should be supplementing NAC or having it injected inside of you? Cardiologists, pay attention. N-acetylcysteine significantly reduced ischemic lesion sizes in both thrombin-induced and FeCl3-induced stroke models. They used a drug to cause a blood clot. But read it what they said. The blood clots, not a joke. It actually helped improve and reduce the size of the blood clots. Look at what it says. Assessed by MRI 24 hours after the stroke. Within 24 hours, they were shrinking blood clots with NAC. How many of you who had a stroke or have blood clot issues have been told you need to be on NAC? And that within 24 hours, it can help dissolve your blood clots. These results demonstrate that N-acetylcysteine administration is beneficial in acute ischemic stroke thanks to its thrombolytic properties. Thrombolytic means dissolving a thrombus, which is a blood clot. Accordingly, N-acetylcysteine treatment induced partial degradation, dissolving of the platelet aggregation, NAC compared to controlled saltwater treated platelets. N-acetylcysteine treatment induced partial disaggregation, dissolving of the blood clot, platelet aggregations after ristocetin treatment, which causes blood clots. They can induce blood clots with drugs and chemicals, but N-acetylcysteine helped to dissolve those too. And then at the bottom, you'll see N-acetylcysteine treatment induced almost complete dissolving of blood clots and platelet aggregations up to 85% compared to the saline group, in line with previous results. Giving NAC alone induced reperfusion, followed by cyclic flow reductions, resulting in significantly reduced ischemic lesion sizes as assessed by MRI at 24 hours. If you've had blood clots, you have strokes, you're being put on blood thinners, tell your medical doctor they need to put you on N-acetylcysteine also. From the studies on humans with N-acetylcysteine and blood clots and strokes and thicker blood, these are the published results that they know N-acetylcysteine has on human blood. This study shows that N-acetylcysteine has thrombolytic effects to dissolve blood clots in arteries and increasing blood circulation. The next thing they highlight is N-acetylcysteine exerts thrombolytic effects, dissolving blood clots essentially by reducing disulfide bridges in large, what's called VWF von Willebrand factor multimers, leading to their fragmentation and subsequent platelet dissolving blood clots. In 3 different experimental models of acute strokes, intravenous injection of N-acetylcysteine induces arterial blood flow to be restored and improves blood clot lesion sizes and neurological deficits. How many of you knew that? If you administer N-acetylcysteine along with a drug, it further increases its thrombolytic efficacy by preventing and possibly reversing platelet aggregation. Aggregation means to come together, so sticking together blood clots. What are the clinical applications for medical doctors to use N-acetylcysteine in a stroke or blood clot situation? They state here on the NIH's website, N-acetylcysteine may constitute an alternative to currently available thrombolytic agents such as Coumadin, warfarin, and heparin, such as tissue-type plasminogen activator and its derivatives, with potential applications in ischemic stroke and acute heart attacks called myocardial infarctions and acute limb ischemia, blood clots in your arms and legs. How many of you knew that? This was published for medical doctors. This is N-acetylcysteine. I'm holding it right now. This is on our website at thedrardisshow.com. You'll see it highlighted. It's got 750 milligrams in every single capsule. So now you know, if you're looking at the research studies we just showed you for mental health conditions, it was anywhere between 2,400 milligrams and 3,000 milligrams a day. You saw improvement in OCD, bipolarism, and schizophrenia. Knowing how much is in one capsule, you now know how many you need per day. What about infertility? It was 1,000 milligrams a day. What about blood clotting? It was 1,000 to 2,000 milligrams a day. 2,000 milligrams I recommend every single day for blood clotting and blood thickening disorders. Now, we showed you early on in this presentation that N-acetylcysteine benefits respiratory infections, RSV, cystic fibrosis, pulmonary fibrosis, pneumonia, the flu. That's why in Doc's Viral Defense, and we are right now in the middle of flu season and common cold season, N-acetylcysteine at 1,000 milligrams a dose, and a dose is 3 capsules a day. There's 1,000 milligrams of N-acetylcysteine in there to help you. We introduced this 3 years ago. It's only one of 5 ingredients in there to help you combat all viral lung infections. Remember, you can scan our code. This is our book, Moving Beyond the COVID-19 Lies. And in some of those, when we get to the blood clotting effects of COVID and the vaccines, I talk about it in the book, N-acetylcysteine, and show you the research and the doses I recommend to help with blood clotting disorders, blood circulation disorders. And I am so thrilled that we have been given the Amazon's bestseller badge over the Thanksgiving weekend in 2024 for our new book, Moving Beyond the COVID-19 Lies. I hope this book blesses you and your family. I hope this presentation actually helps you and your family. And remember, if there's anybody you know or love who are struggling with any of these health conditions we just mentioned, N-acetylcysteine is at the Dr. Ardis Show, Doc's Viral Defense. It's also there. I'm Dr. Ardis. God bless you. We'll see you next time on the Dr. Ardis Show.
Disclaimer. Please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it. Do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.